history is a 8-year-old boy who is John.
Mm-hmm.
John present with his mother. Mother is Salma. John has eye swelling. So you need to take the history, focus history.
Okay. Okay. Sorry. Okay. Good morning.
Yes, good morning.
I'm Dr. Sarah, one of the children doctor here. I believe I'm talking to Mrs. Selma, John's mother.
Yes,
Nice to meet you, Mrs. Selma.
nice to meet you.
Mrs. Selma, today I'm here to take some notes about John Health, and I will write it down if you don't mind.
Yes, yes, of course.
Okay. Mrs. Selma, can you tell me what is your main concern regarding John today?
My main concern is that John has sudden developed eye swelling 3 days back. Now it is increasing. That's my problem.
So sorry for that. And can I know which eye, or
Yeah,
one
this
eye,
is
or both eyes?
yeah, his right eye.
This is right eye. Is it increasing or static since started?
It was actually at the beginning increasing. Now we have given some painkiller. Now it is, I
Mm-hmm.
think, not increasing that much. But he's not going okay.
Okay. Is it painful? I mean, he is feeling with this pain, with this eye
Yes, yes,
swelling?
yes. It is painful.
Uh, okay. He can open or he can't open the eye, his eye.
Yeah, he can open the eye, but I don't think fully he can open the eye. It's swelling.
Okay. Okay. Any discharge from that eye coming?
No, only redness, no discharge.
Uh, okay. Can I know whole eye? I mean, above and down.
I didn't get.
I'm so sorry. I mean, even his eyelid or hold the eye or
Yeah, his lower eyelid.
lower eye. Any history of trauma, Mrs. Selma,
No, I don't think any trauma.
or any this insect bite or insect sting for that one?
Actually, he play with go outside, play with his friends. So
Mm-hmm.
I don't think, but I also thinking is it that any allergic reaction or not?
Okay. Okay. And okay. Any itching with that eye swelling?
No, there is no itching.
Okay. Any fever, Mrs. Selma, did you notice?
Yeah, he has some low grade fever.
Okay, I'm so sorry for that. And when you are giving this painkiller, it is improve or no?
Yeah, pain reduce.
Uh, okay. If you give him this color, he can differentiate between this green and red or no?
Actually, we come to the hospitals. We have not asked him. He can
Um,
green
uh,
or red
uh,
differentiate or not. But it is difficulty
okay.
to him to see anything.
Okay, I'm so sorry for that. Okay, this is the first time or before happened?
This is first time.
Okay. You have any other concern, Mrs. Selma?
No, I have no any other concern. I just want that he will be okay.
Okay. Okay. You have any long-lasting illness before? Or?
No, no, nothing. He's a healthy boy.
Okay. Okay. His condition affecting his weight nowadays, or
No,
and his activity.
yes, activity is now not active. He's feeling pain on his eye.
I'm so sorry for that. And also his sleep pattern changed with this condition or no?
First day, when 3 days back, he can't sleep.
Mm.
Then the next day, we go to the hospital.
I'm so sorry for that. Okay. Any when you are hugging him, you feel any heart racing?
No,
Okay. Any repeated chest infection or any cough?
no,
Okay.
no,
Any change in his Any change in his tummy size?
no,
Any pain in his tummy?
no,
Okay. He's feeling of any headache,
no,
any abnormal, any early morning vomiting, Mrs. Selma?
no, nothing. nothing.
Abnormal movement, do you notice?
No,
Or any weakness in any part of his body?
no, nothing.
And what about his hearing and his vision?
His eye, he can't see, I already tell you. And
Mm-hmm.
there is, eyes become red, swollen,
Uh-huh.
that is. And
Uh,
hearing, actually, 2 to 3 months back, he has some ear infection present. Some repeated
mm,
ear
uh,
infection he has present.
that ear infection. I'm so sorry for that. Is that repeated ear infection?
Yeah, yeah. He was when child, then it was his
Mm,
problem. We go GP
okay.
visited 2 to 3 times.
That with ear discharge or only infection only?
Infection actually. He cry. He
Mm,
feeling pain inside
uh,
the ear.
you treat that one or no?
Yeah, he's treated with the GP. It was okay
Mm-hmm.
previously.
Okay. Okay. Um, okay. Okay. And he is preferring this hot or cold weather. Did you notice that?
No, nothing. He never mentioned anything about that.
Okay. Any pallor did you notice on
No,
any joint pain? Joint,
no,
joint is swelling.
no,
Any skin spots?
no.
Okay. You are following with any team?
No, no. He's a healthy boy.
Oh,
We're not following any team.
okay. He was admitted before or no?
Oh, yeah, he was admitted when he was 2 years age old. Then some chest infection that doctor told bronchiolitis.
Okay. Any regular medication he's getting?
No,
Any operation recently done for him?
no,
Okay. When you are pregnant with him and after born him, any concern you have?
no, no. It was normal after delivery, the discharge as we go home.
Okay. He received all his shots?
Yeah,
Any extra shots?
yeah. One extra shot doctor prescribed in the school they given he took.
Okay. Regarding his the development in walking, so talking and socialization, you have any concern, or he looks like his peer, or no?
No, I have no any concern.
He have any allergic to any medicine
No, no any medicine allergy.
or any diet, any food?
Yeah, he has some food, apple allergy. I don't give him apple and tomato.
Couple and tomato. You have any this emergency plan for that one?
No, no, nothing emergency. It was a simple. I think 9 minutes over.
Okay, 9 minutes finished. Okay, and tell me about his nutrition more. I mean his food, his dietary
Diet
habit.
habit is nothing special. Family diet, what we eat, he also eat. Regular diet.
Okay. Um, can you tell me about your family, please?
Yeah, my family actually me, my husband, he and also his younger brother.
Mm-hmm. Okay. Any similar condition in your family, like John?
No,
Any chronic illness?
no.
What you are doing for living?
Yeah, I am, teacher. My husband is also teacher.
Okay. Your income is satisfied for you?
Yes,
He's going to school,
yes.
mainstream or special school?
Normal
Okay.
school.
What about his performance and attendance?
Yeah, his performance is good.
Mm-hmm. Any bullying he's facing?
No, nothing. No bullying, he's told
Mm.
me.
What is the impact of his condition on you and his family and him?
Yeah, we are really worried. It is eye related. So what will be happen? I want that he will be get well soon.
I'm so sorry for that. Okay. Okay. Uh, Again, I will ask you about this more. He have any upper respiratory tract infection recently? This is Selma.
No, nothing.
Any runny nose or any?
No.
Okay. 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 Mrs. Selma, I will revise my notes. If I want to ask any question, I will come back to you. Yes,
Okay.
okay, Ratan. I
So
don't
please
know
present your
what I missed.
case.
Okay. Okay, today I took history from Mrs. Selma, mother of John. He is 8 years old. She complaining of eye swelling. Cannot remember since how many days, for few days, and in one eye he's red and swollen, no discharge, no history of trauma, no history of allergy, and no history. I should ask about no history of this insect bite. And this is painful, and he cannot open his eye, and also he has repeated ear infection, but treated, and also he received all his shot, and of good socioeconomic status, and this his condition, and mother is too much worry and anxious because she afraid from this eye problem. Putting all this together is a case of eye swelling and redness. For differential diagnosis, I will put orbital cellulitis in the first of my differential diagnosis.
And differential, what are other
The,
DD?
sec- the other, I will put preorbital cellulitis, then could be trauma, or it could be also stent, and also if bilateral, I can put anaphylaxis, or if also I can put, if with generalized body swelling, I can put also nephrotic syndrome.
Okay. So the presentation would be like that. Today I have taken the history from mother of John. John is 8 years, 8 years old boy who has come with the chief complaints that he has 3 days of eye swelling. On history, that is the in S. Then the background, what I find, the eye is swelling. It is very, very difficult to see him. He is feeling pain. He has taken some medication for that, and the pain is reduced. Uh, there is a swelling. You have not asked that any other parts of the body swelling or not. That is very
I
important.
asked,
Yeah.
I asked
Any
only the joint, sir. I asked the
uh,
joint. Yes.
any swelling, there is no any swelling any other parts of the body, and one of the eye swelling is affected. There is a low grade fever present. Okay.
Mm.
Then we find what is that the child has repeated ear infections. For that, he has on past history he has bronchiolitis. He admitted once in the hospitals. Other
Mhm.
positive, nothing present. We find just psychologically the mom is very much worried about his conditions. This impact in the family. So putting all together, the diagnosis on top is orbital cellulitis. So your history was good. Just I think any swelling in any other parts of the body you have not asked, or sequence of swelling. Okay, this is very
Okay.
important because when someone tell is eye swelling, then we need to do some DD in our mind, unilateral and bilateral. So unilateral, it can be allergy, sting bite, eye trauma, orbital cellulitis, eye infection secondary to facial palsy, and exophthalmos. Any facial deviation you can ask. Okay, facial
Yeah,
palsy
I
also.
didn't ask. Okay. Okay.
Exophthalmos, you ask about hot and cold intolerance because hyperthyroidism one of the cause. Then bilateral, if it is a nephrotic syndrome, nephritic, orbital cellulitis, anaphylaxis, cardiac failure, renal failure, liver cell failure, malnutrition, kwashiorkor, protein-losing enteropathy, exophthalmos. So diet is also normal, so no malnutrition. And other part of swelling you have not asked. So do you ask about the pee and poo?
Boo, yeah, I asked.
Okay, pee
P,
and poo also ask renal failure, any swelling in any other parts of the body. So this is all
yeah.
about the DD. So how can someone tell us that eye swelling keep complaint? First we'll ask like unilateral, bilateral, onset, course and duration, what make it better, what make it worse. Any diurnal variation, any swelling in any other parts of the body, sequence of swellings, red eye, excessive lacrimations, oozing, pus, affected visions, pain when moving eyes, bulging eyes, light intolerance, green or red color differentiation. These are. Then, after present analysis, we ask about the fever, weight, activity, affected, sleep affected or not, any sting bite around the eye or elsewhere. We ask other concerns like any dysmorphic feature, chronic illness, or long-term medical conditions. You ask everything. Then, CVS, number of pillows he is using, any chest pain, exercise intolerance, awareness of the heartbeat, blood pressure. CNS, sign of increased intracranial temperatures like headache, fainting, altered consciousness level, unusual movement, fears, hearing concern, unusual gait, facial asymmetry. So facial asymmetry also important here.
Yeah,
Urinary
yeah. I
change in the
forget
pee
this one.
color, amount, frequency, pain, frothy urine, recent back urinalysis. Pain is also important because nephrotic syndrome one of. Our examiner should need to know that. That is, we are searching the DD. So frothy urine, P is very important. P color, amount, these are. Also renal failure is one of the DD. CVS heart
Okay.
failure is one of the DD. So we ask all this. GIT, tummy size, tummy pain, loose poo, throwing up, yellow eye, chest, cough, cold, recurrent bugs, rapid breathing, noisy breathing, oxygen saturation, MSK skin, skin spots, lumps, joint pain, joint swelling, change in hair and nail, hematology, pallor, bleeding, bruising, endocrine, important, heat intolerance, blood sugar measured or not, because hyperthyroidism is one of them. Okay. Past history, trauma, treatment, traveling, transmissions, any blood transfusions, these are any team following. If so, it is an acute history. So no any past history much important. Perinatal history as usual, puberty as usual, vaccination as usual, allergy very important because sting bite allergic reaction is one of our DD. Nutritional is also very important because nutritional edema. Development normal family history. We ask family history always important. Social psychological these are. So this is all about the history. For this history, how can we manage this history? First, I will assess his conditions, his vital signs, ABC vitals, his consciousness levels, general examination for the sign of any sepsis, eye examination, ENT examinations, neurological examinations. These are. Then involve my consultant, ENT, ophthalmologist, neurologist, if needed for neurosurgeon. And some investigation we will do, that is blood, CBC, CRP, ESR, culture sensitivity. Imaging, we do the CT and MRI of the brain. Another swab from the eye if possible. So after assessment, examination, I will do some investigation. Of course, I will involve my multidisciplinary team, my consultant, ENT ophthalmologist, because it can be an eye emergency, like orbital or periorbital cellulitis. If it is a periorbital cellulitis, review eye movement and red-green color vision. It is an orbital cellulitis, urgent ophthalmology ENT review within 4 hours for surgical drainage. So we can do that. What is your case? Orbital or periorbital cellulitis, you think?
For me, orbital. Huh?
Yes, it is an orbital cellulitis because pain is increasing. The child unable to see. 3 days already gone. So
Oh,
we do urgent ophthalmology ENT review within 4 hours for surgical drainage. And orbital cellulitis, what we give the treatment? Ceftriaxone or cefotaxime IV. And if toxemic, we add clindamycin. If penicillin anaphylaxis, we give ciprofloxacin plus clindamycin. So our case, we are giving ceftriaxone or cefotaxime IV. Yes, our case is not anaphylaxis and it's not toxic. That clindamycin is toxic. These are
okay.
duration is 21 days to 6 weeks if bone involvement. That is our treatment. If periorbital cellulitis, what is we giving? Oral coamoxiclav.
Coamoxiclav.
Yes, both eyelids severe or no improvement after 48 hours. If it is severe periorbital cellulitis, we think we go the coamoxiclav IV. And when condition is improved, we also shift to the oral coamoxiclav.
Oh,
14 days is the duration. So periorbital 14 or orbital 21 days. Some complication is very important. Orbital cellulitis common also video stations. What are the complications? Eye and neuro. Eye are orbital abscess, optic neuritis, blindness, exposure keratitis, glaucoma, panophthalmitis. Neuro is cranial nerve palsy, subperiosteal abscess, meningitis, cavernous sinus thrombosis. These are indication for admission. These are suspected orbital involvement, fever, immunocompromise, no improvement after 48 hours of oral antibiotics, and less than 1 year old child. So our admission indication is that no improvement after 48 hours. That is a 3 days duration. That's why the child has can be sinusitis present. Our child has present, that is repeated hearing infections. These are indication of CT scan is suspected orbital involvement, central neurological sign, inability to eye assist the eye movement, bilateral edema, deterioration despite treatment. MRI also suspected intracranial involvement. So this is all about orbital cellulitis. Thank you very much for your participation.
okay,
Okay.
thank you. Really, thank you.